We're gonna saline the lock, the IV, after the second liter of the normal saline. So everything would theoretically be done. But just make sure everything's clamped so nothing is leaking. Take the tape off. So just to make sure that after we discontinue a medication, we want to just flush this quick to make sure that everything is good to go. You just have to do about 5 milliliters. So everything is okay there. So we would just want to check the patency of the IV. You can take the tape off and reassess the skin around it and kind of like educate the patient on how to maintain their saline IV lock and what to do and what not to do. Obviously, we want to make sure that we're flushing it regularly to ensure that it's still patent and it's able to get flow through it. So the next order is to give Dilaudid 2 milligrams every 2 hours as needed. So the label of the Dilaudid is 2 milligrams per milliliter, and you want to dilute it with 2 milliliters of normal saline for IV administration. So we're just gonna do 1 milliliter of that Dilaudid. So this is the Dilaudid. 1 milliliter. And then we want 2 milliliters of normal saline. For a total of 3 milliliters of medication. 3 milliliters. We're in the patient's room. This should be labeled if we were taking it from the medication room. I just want to get 2 patient identifiers, do my double check against the MAR at the bedside, do your 6 writes of medication, and 2 patient identifiers if I didn't already say that. So then we're going to clean this off. We want to flush before and after. Flush the first time to make sure that it's working, which it is. Put the medication in. And then flush again to make sure that all of that medication gets through. Afterwards, you just want to make sure that the patient doesn't have any adverse reactions to the medication. Place their call light towards them and lower their bed. Make sure they're comfortable. The order has been called to discontinue the IV. So when we go into the room, we can explain to the patient we're discontinuing their IV. Do your patient identifiers, 6 writes, check against the MAR. You can use adhesive remover when you're taping this tape off if it makes it easier. The IV looks, or the catheter looks like it's in sight or intact. And then we would just want to hold pressure. And then put a dressing on. Make sure that we don't have any signs of infection. We want to educate the patient on their signs, what to look for signs of infection. And then we would just need to document that we discontinued the IV and we put a pressure dressing on. And yep.